I'd like to talk about what people have an interest in, and I have an interest in some of the scholarly stuff that maybe some other people aren't as interested in as I am. And so, but I'll start off with that a little bit, and then we can get in and talk about some of the more practical kind of issues here around how to maintain kids in placements and so forth. So certainly we would try to get to that. So I say over the years that I worked for, some of you probably heard me say I worked in this child welfare system in this state for 26 years. And, and I worked 7 years before that in Colorado as a caseworker. And I think in all of that time, the main thing about foster care that bothered me, distressed me more than any other single thing, and there were a lot of things that were concerning, but the most concerning thing by far was the multiple placement thing from my standpoint. And of course, okay, yeah, sorry, my dog is a lab and she goes off when people. So anyway, I was saying that the multiple placement thing always bothered me. And of course, it's not all kids in the system, and which we're going to talk about here in a minute, but it's always been a significant fraction of them. And this is one of the subjects that, so I'm going to give you some statistics here in a minute, but where I don't really think averages or medians or whatever you want to talk about matter as much as in some other areas, because however you say this, when you talk about an average, so for example, a recent report that came out last week from some scholars in another part of the country found that for kids who entered care in 2015, this is nationally, the median length of stay was 15 months, meaning half the kids stayed longer than 15 months, half the kids stayed less than 15 months in foster care. And the median number of placements for those kids was 3. So 3 placements in 15 months. But of course, that means that half the kids had more than 3 placements, and more than half the kids stayed for more than 15 months. So there has been always a fraction of kids, and I would say anywhere from maybe 20 to 40% of kids, something like that, in foster care, who have had, particularly the ones who have been in care for more than a year, who have had, bounced from home to home, and where foster care systems have had a lot of trouble in stabilizing the kids. So when you talk about multiple placements, then, one obvious, easy way to talk about it is just add up the number of placements. I mean, that seems really commonsensey and simple. And yet, in terms of scholarly studies, it's never quite as simple as that. So as an example of what I mean, so the federal government, for example, and the way they put together statistics, sometimes they will not consider kids who have been in care for less than 3 days or for less than 4 days. They'll knock out all those short stayers who were in overnight, like police picked up the kids at a drug bust or something like that, and they were released the next day. Sometimes the feds will just not even consider all of those kids in their statistics. And then in past years in this state, not so much in recent years, in past years, maybe a fifth of kids stayed in care for less than a week. I mean, it used to be that foster care systems, particularly the foster care system in this state, had a really lot of brief placements. And that was partly because we had if you remember, those of you who are veterans, we had a family reconciliation services program that had dealt with parent-child conflict. A lot of those kids came into foster care, and there were 5-day limits on stays in CRCs. And so a lot of the kids who came into care, they didn't come in for abuse and neglect at all. They came in for parent-child conflict. They had brief stays in care. And those kind of kids kind of distorted the stats there, right? So a lot of kids have always come into foster care for brief periods of time. Usually they have a single placement, and they end up going home fairly quickly. So this is one of the reasons that averages turn out not to mean so much here unless you start controlling for length of stay. And so, So one of the basic, most simple kind of ideas here in the scholarship is that the longer kids stay in care, the more likely they are to have more than one placement, more than two, more than three placements. I mentioned that kids entered care in the United States in 2015. The median number of placements was three. When I did about 20 years ago, I did a study of multiple placements in this state, a long, lengthy study, which I disseminated at the time I was a regional administrator. That particular study eventually led to my departure from the child welfare system in the state because the powers that be didn't take it well that I had written a study on this subject and disseminated it and so forth. But one of the things, and that study was based totally on Washington state data. Well, this was 20 years ago or something, but what I found was that once kids had been in care for 2 years, and that was a lot of kids. Once kids had been in care for 2 years, at least half of them had five or more placements. So very strong relationship here between the length of time that kids are in care and the number of placements that those kids have. So that's one, of course, so that's one way to count there. Some of the scholarship that I like the best, I sent Ryan earlier today a summary sounding board that I wrote on this subject in 2012. And in that summary, I focus on a study done by David Rubin, a scholar, very good child welfare scholar, and in past years at the University of Pennsylvania Medical School. And in his particular study, which was an NSCA study, the National Study of Child and Adolescent Well-Being there, the proxy measure that they used for placement and stability wasn't the total number of placements. It was the percentage of kids who were in place in any single placement for 9 continuous months during the first 18 months in care. So I want to say that again. So Rubin, that group decided instead of just counting up placements, they were going to take kids who had been in care for an 18-month period of time, and they were going to look at the percentage of kids then who had been in a continuous placement for at least 9 months out of the 18-month period of time there. So in other words, what they were doing is they were kind of discounting early instability. They were sort of acknowledging that a lot of kids who come into care, child welfare systems might have trouble finding appropriate places for them. And maybe for the first month or two, they would move from home to home. But hopefully, if the system was working well as designed, there would be a home found that would stabilize the kids in care, and they would have so to speak, a stable permanent home, or at least a stable home for the time that they were in the foster care system. Well, so using that measure, and remember, this is probably from data 15 to 20 years ago, something like that. I mean, Rubin there found that for the kids who were 10 to 17, sort of in that age range, almost 31% of those kids didn't have a continuous, almost 30% of the kids didn't have a continuous placement for 9 months out of the 18-month period in care. That is, once kids got to be 10 years old and up, foster care systems had a lot of trouble in stabilizing them. And there was almost 1 in 3 that at the end of 18 months, they had not been in continuous placement for 9 months out of that period of time. And for the whole population, for the 0 to 17 group, that was about 1 in 5 kids. So, much lower rates of instability for the younger kids, much higher rates for the older kids. So this has been, over the years, one of the sort of common sense findings about multiple placements that just about, all of us who work in or around child welfare systems can understand. That is, kids who come into care, a lot of school-age kids with behavior problems, those are the kids that child welfare systems have the most trouble in stabilizing. And that's why in past years, when I've written commentaries on foster care, I tend to focus on the theme that foster care is kind of a dissected system. That is, that there's one set of resources, one set of practices, one set of outcomes that's pretty much true of the kids in the 0 to 5-year-old age range. And then another set of practices, resources, and outcomes that's more true of the kids who are in the 6 to 17-year-old age range. And those tend to be two kind of very distinct kind of worlds. And so when you start averaging them together in these statistics, in my view, it's not that the stats are wrong or false or anything like that. I just think that they present a misleading type of picture here. And in more recent years, when foster care now has been extended in this state and lots of other states from age 18 to 21, there is a whole number of set of other outcomes for kids in that 18 to 21-year-old age range. Okay, so that's like a third kind of a group. So before I go any further there, and let me just stop and see if anyone has comments or questions before we start talking about a little more the nitty gritty of this. Okay, so those of you who've been around, you've worked with kids in foster care for some time, and you've had enough experience, probably many of you, with foster care, that you know that kids are moved for a wide variety of reasons. So in the first place, when I worked in the child welfare system in this state, even when child welfare was working as designed, a lot of the kids would end up within 3 placements in the first year. So many of the kids would come into care, and initially they would go into a receiving home. So this was a state that used to give a set of foster parents stipends for being available on a 24-hour basis. And a lot of the kids would come into care in those receiving home placements with the idea that they were going to leave within a few days. I mean, sometimes they would stay 2, 3, 4 days. They would either return home or they would go to a, so to speak, more regular kind of foster home, or that would be a very normal. And then, of course, the kids, a lot of times who went from the receiving home to the foster home, then maybe 6 months later, 8 months later, it appears unlikely that there's going to be a reunification. And some of those kids then would be moved into pre-adopt homes. So by the time that the kids had been in care for a year, they would have been in 3 homes, even when the system was operating pretty much as designed, as the receiving home, regular foster home, then a pre-adopt home. But of course, there would always be some of those kids who, for one reason or another, would have to be moved even within that first year. And sometimes that would have to do with just events, didn't have anything much to do with the kid at all. Sometimes it would just have to do with the lives of the foster parents. So remember, this is a kind of an inherent issue when you have a business model, foster care business model, that depends on a volunteer group of people who aren't being paid, or who are being paid, in theory at least, for the cost of care, but aren't being otherwise paid. So foster care is something they build into their lives, but a lot of times when push comes to shove, at a particular point in time, they just don't have room for it. So people have illnesses. I mean, they have divorces, they have mental health crises, they have all kind of things happen, or they just plain old move. I mean, someone gets a job in some other community, they leave the area. And so for reasons a lot of times that don't have anything to do with kids at all, kids may end up being moved there. And then, of course, there are the kids who are being moved because of their behavior problems. And here is where you get into kind of probably the largest single reason for the school age kids being moved, and sometimes younger ones as well, the kids being moved around in care, is of course because of the behavior problems with which foster parents are unable to cope. And this is the reason that for years I have maintained that we need a professional group of foster parents that are trained, that by virtue of education, by virtue of experience, and also because they want to, by virtue of motivation, they are prepared and they want to take care of behaviorally troubled kids. And then in the absence of a group of people like that, it is very hard to stabilize a lot of the behaviorally troubled kids in care, and particularly the acting out kids. I mean, the kids who have oppositional behaviors, conduct disorder kind of things, who are very, very difficult to manage there, really. So a lot of those placements, of course, will fall apart really within the space of a few weeks or months. And in past years, oftentimes it wasn't just that the placement ended, a lot of times it would be how the placement ended. So the placement might, for example, end in an emergency call from a foster parent to an intake line at 9 p.m. at night. They've just been in a fight with a foster parent's just been in a fight with a foster kid, and the foster kid used some foul, insulting language, and the foster parent wants the kid removed instantaneously, or at the very latest the next morning. So it's not only that the placements were not stable or that they ended, it was how they ended. They ended in some kind of emergency ejection of the kid from the foster home. And of course, that is sort of a form of rejection that has a very potentially very powerful impact on the emotional functioning and behavior of kids, particularly when placements end in that way. So I guess the idea I'm trying to get across here, the issue of how many placements kids have, that's kind of a rough proxy measure for the concern around this issue. A lot of it has to do with the emotional impact of moves, and particularly the moves that are unplanned and the moves that amount to rejection of the kid that are doing kids a lot of psychological damage there. And so the question a lot of times for those, particularly the conduct disordered kids, the oppositional kids in care, the ones that are being subject to these emergency ejections and so forth, is whether foster care is doing these kids more harm than good. And I began to wonder that as a caseworker, a supervisor, and then later on as a manager, because many of the kids I saw in care were school-age kids that were not flourishing. And of course, they were being moved from home to home until finally, this way, at least it used to be in child welfare in this country. And finally, at some point, the foster care systems would kind of give up on the kids and then say, well, there's not going to be a family for this kid, but this kid needs to be in residential care. And so we're going to move the kid into the BRS system, which of course, BRS stands for Behavior Rehabilitation Services. And those are high cost kind of placements. And there used to be, of course, lots of brick and mortar facilities, not so much anymore. And in more recent years, of course, those are generally be private agency kind of programs where there is a foster home. And sometimes the foster home has three or four kids. But so one of the things that's been very distressing, I think, in the last 10 years or so, at least from my standpoint, is that even those therapeutic programs, even the private agency programs, a lot of times have been unable and sometimes even unwilling to take the behaviorally troubled kids, and particularly the ones that have proved the most difficult, aggressive, assaultive, not to mention things like setting fires and here we're not even talking about the chronically mentally ill kids who probably need to be in a more of an institutional kind of a setting. So again, let me kind of stop here and see if you have comments or questions
here. Is there anything that you know of that actually helps with the kids? We all work with some kids who are just moving from place to place. They do okay when they first arrive there, and then like clockwork, something happens and they're ejected immediately. They have to leave school, and it just happens over and over again. Is there anything that, any treatment, any setting that's actually effective?
Yeah, so let me just say a couple of things about this. And this is why for a long time I have been very much an advocate of the professional foster parent kind of idea here. And the main reason is that there are very good evidence-based programs for conduct disorder. So this isn't like we're helpless or we don't know what to do in relationship to oppositional kids. And so there are good evidence-based programs that can be used in schools and juvenile justice facilities and child welfare systems. And so there is a knowledge base out there, but of course, someone really has to deliver those kind of services, some kind of skilled person. And there has to be a program and people who are really willing to hang on to kids while those kind of services are being delivered there. And that's why I say that you have to have a group of caregivers who have made a commitment to hang on to kids. And so there is a book I want to recommend by two authors. One guy's named John Sprinson, the other guy's named Ken Barrick. Well, they have run a facility in California named Seneca for years and years. And this takes the very highest need, highest cost kids a lot of times in the both in the child welfare and the juvenile justice systems in that state. And they have been very successful at working with those kids over the years. So one of the sort of the axioms, the fundamentals of that program is that they provide unconditional care. So when you talk about providing what you want from a therapeutic kind of a foster care program and what you want from professional foster parents is a absolutely unconditional care commitment to the care of a kid. That is, there is nothing that is going to get this kid ejected from this home, barring homicide, or the kid slits their throat or something like that. You know, we just are not going to kick the kid out of this program for obnoxious behavior, or even if that means assaulting staff or whatever. We're going to figure out a way to deal with it there. So now there have been some of those, there have always been some programs in this state. So the idea that residential care is always bad, that it always fails and everything, that's not true. There has always been a percentage of programs that were pretty good at stabilizing kids in care. And by pretty good, I don't mean perfect, but I mean that they were generally able in the majority of cases to hang on to kids and to actually do them some good while they were in the, you know, the foster care system or in the residential care system. What happens, however, when you don't have good residential care systems is that, and particularly when they're not well managed, is that those kids in residential care are very, very subject to lots of bad things. And there have been residential care scandals in this state, I mean, really serious ones, where kids have been beaten up, where they have been sexually molested as initiation rites. In OK Boys Ranch, over a period of 15 years, kids were sexually assaulted by other boys with the full knowledge of staff. And that was part of an initiation rite in that facility. It went on for a long, long time. So that's the kind of thing that can happen when residential care facilities are poorly managed. So there is, I guess what I'm saying here is that there really is a knowledge base. There is a way to do it. There is a professional kind of a foundation there, but we have one, you got to be willing to fund it. Second, you got to be willing to work with it over a period of time and try to improve it and make improvements in it. So yes, there are mental health programs out there that would be helpful, but again, you have to be able to stabilize kids in homes that have a commitment to hanging on to the kid. And that's why I say, so years ago, for example, in New York City, there was a program, kind of a adoption program for older kids called You Gotta Believe. And this at a point in time, maybe 10 to 15 years ago, this program had become kind of famous. But the idea of the program was that they were going to tell foster parents in initial training that we're not going to take kids in care and then eject them. We're not going to do more harm than good here. And we want foster parents in this program who are going to make a commitment to kids. And that's going to be a part of what it means to be a part of this program. So in my view, the only way to do that at scale, that is across the state, is that you're going to have a professional cadre of people who are going to make that kind of commitment and then undergo the kind of training and accept the supervision and that is going to be needed to make that happen. So this idea that somehow we're all completely helpless to deal with this or something like that. No, we're helpless to deal with it because we haven't made the right investments. And at a public policy level, we haven't done the right things. So within the last 2 weeks, I was talking to Ryan before we started today. So the state now has entered into an agreement with plaintiffs in this federal class action lawsuit that came out of the hotel placements. in this state. And so part of that settlement agreement is a commitment to develop a cadre of professional foster parents. So this is the first time that this state has ever indicated any kind of willingness or commitment to do that. And so this is, in my view, a promising first step. It's hard to know what will happen as a result of it, but we're, at least I'm kind of hopeful. I've sent around this information to a lot of people, and some of the responses have been pretty skeptical because for lots of people who've lived in this state for a long time and seen these conditions just go on and on and on here. So let me just say a couple of other things about the things of what can we do that states have tried over the years and have been done in this state with varying degrees of success to some degree or other. So of lots of states have made investments in what I might call crisis intervention, mental health services. So the idea is to at least get even volunteer foster parents to agree that before they cause a kid to leave the home, that one, they will never do that on an emergency basis, and that they will call the caseworker, if they're thinking we just can't handle this anymore. And the caseworker will then get together a meeting the very next day with the foster parents and the CASA and any professionals that might be involved in the kid's life, and they will talk about whether it is feasible to save displacement. Is there something we can actually do to make this work? And sometimes there is, and then I think at other times, perhaps there isn't. I mean, sometimes relationships have gone so bad and have become so infected that there's no kind of saving them. And that would be true in foster care. It'd be true in anything else. I mean, it'd be true in marriage. It would be true in friendship. Things can go so far and get so bad between people that there's no way to patch it up. But the idea is to intervene early enough around, well, what can we actually do to make this work? Now, sometimes what happens is, if you have kids and if you have youth in foster care, sometimes the kids, end up moving from home to home. Sometimes, of course, the kids just plain run. I mean, there's a whole bunch of youth who, just decide for themselves that I've had it with the foster care system, and I'm just going to leave and I'll live on the street if I have to, or I'll live with friends. Or I would rather live by being a prostitute. I mean, there are actually youth and child welfare systems who actually make those kinds of decisions when they've had a lot of unsuccessful attempts, to quote, help them. So on the behavioral, to go back to this, so what can we do in the short run? We can try to, at the short run, foster care systems can ask foster parents to make commitments and to make them in writing at the time of licensing that we are not going to ever eject a kid, just call up an intake line and saying, you got to come get this kid. In past years, the way that was done sometimes is foster parents would make those kind of calls, and then they would actually put kids' possessions, clothes and everything in a garbage bag, literally in a garbage bag, and put the garbage bag out on the porch along with the kid. I mean, that's how bad it really was. And when I was a regional administrator for 7 years, from the late 1990s, early 2000s, I mean, we made a policy in our region. We would never use garbage bags to transport the possessions of kids, because what kind of message is that delivering to kids? So we went out and got hundreds of athletic bags, stuff like that. And so, but in terms of being able to stabilize a lot of those kids in care, it's very, very difficult to do that if you don't have caregivers who are prepared to deal with them, and particularly with the aggressive kids, the potentially assaultive ones, as they get older, and not to mention the verbal abuse aspects of it, which can be very, very extreme. So again, let me, and I do want to recommend this book, by the way, the Brinson and Berrick book. The name of that book is Unconditional Care. And that's the best book that I've read on residential care that's come out in the last 10 to 15 years. I even at one point wrote a review of this book. So I recommend it. And so again, let me stop here and see if you have comments or questions.
Yeah, I would like to. I've seen some success with residential care. I get concerned at the high turnover because, of course, they're not going to, like you said, it's unconditional care. And so the child is going to be there, for the long haul, no matter what the child does. And so there is a huge turnover in caregivers and staff. However, the consistency of staying in the same place and the same rules and the same kind of food and the same people at school, the same teachers, even though the staff has changed, I've seen some real success with. We have a couple of kids who are who might be graduating out of residential care because their behaviors have become almost non-existent, and hoping to get them into a BRS home because they're still going to run into issues because they do have some serious history, but I just wanted to mention that the consistency of them being able to stay in the same place with the same rules, and it's all positive. They earn their stars, and it's all really, really consistent. They know what's coming. They know what's the schedule is. They know how to earn the stars, and they even, when they start having family time with their families, and or meet with their past foster families to connect, they implement the star system into those relationships. Mm-hmm. Like, Dad, you didn't swear during this time together, and so you get a gold star. And so I have seen some success more recently. I just wanted to mention that.
Yeah, and I want to say thanks for that, for the comments there. And I want to say that over the years, I have seen similar kind of things. I have seen some of the programs really be able to hang on to the kids. And even though a lot of turnover among the staff and so forth, but you also got to remember that the quality of residential care programs varies tremendously. And when those programs are not well managed, then there's the potential for many very bad things to happen there. And one of the really bad things, of course, is kids being bullied. Younger kids being bullied by older kids. And so this is really always a potential in residential care. And as causes, this is something that you have to be, and I would hope that you would be very, very sensitive to. Because that's a lot of what's gone on in the worst scandals, in the worst kind of horrible things that have happened in this state and lots of other states. It's been those bullying type of relationships of stronger kids taking advantage of younger ones in all kind of bad ways. So, but the importance of being able to stabilize a kid in care, you can't say too much. Again, just give kids kind of an opportunity, to make adjustments to whatever kind of environment they're in there. So other comments, questions on this before I change the subject here a little bit?
This is Wiping Lelanders from King County. I'm sorry I didn't actually get to listen to all of your talks, so hopefully I'm not really out of context here. So what percentage of those kids are actually having pretty significant issues that they are really bouncing in and out of the homes, or is it would majority of the children, if some support, For example, if there would be preferred placement with a relative or somebody that the children already know, that would actually have some sort of service can kind of help them to stabilize or something like that. Well, yeah, thank you.
Okay, yeah, so let me talk about this a little bit. So when we talk about, yeah, so of course what you're saying is true. There's a whole bunch of kids who don't bounce around in care. So when we talk about, we tend to focus on the kids who do, the multiple placement kids, because we're all concerned about them. But yeah, no, there's a group of kids, and particularly the kids who don't necessarily have a lot of behavior problems, who are stabilized in care. And even the kids who have behavior problems, maybe as many as, sorry, my dog has a mortal, views the mailman as a mortal enemy there, kind of thing there. So let me go back to say first on the kinship care issue. So one of the things we know that's positive is that generally speaking, kinship placements are more stable than non-kinship placements, even when after you control for behavior problems. Now, however, just to say this, there's lots of behaviorally troubled kids that kin care providers are no more able to care for them or to stabilize them in care than non-kin providers are. So some kids, and particularly the ones whose behavior problems are kind of moderate or not at the most severe kind of level, yes, they can be placed in kinship placements, and with the proper kind of supports, they can manage to grow up there, right? But there's a whole bunch of kids who aren't stabilized in kinship care and are not going to be. And so there's a very common thing that used to happen in child welfare when I was there, and I think it still happens a lot, is that kids would come into foster care when they were young, and maybe in the preschool years between 0 to 5, and they would be placed in a kinship placement. And at some point in time, there might be a guardianship, something like that, that would make that a permanent placement. And then when the kids were about 12 to 13, that kinship placement itself would destabilize for various reasons, sometimes because the kinship providers were getting older, because they had health issues, or just because the kids' problems had become worse as they became teens. And so you ended up with kids back in the foster care system in their teenage years, who for several years had been in stable kinship care placements. And that is very, very common. So the last number that I had, for example, the last number I saw on this subject is that for all the kids in foster care, this was a study in one state. This was not in Washington, but a study in another state. For all kids in foster care at a point in time, of all the kids who were in the 12 to 17-year-old age range, 1 in 6 of those kids had entered care from the ages of 0 to 5. So I'm going to say that again, 1 out of 6 teenagers in care at a point in time entered care from the ages of 0 to 5. Well, why are they still in care? Because they had permanent plans that failed. They had been reunified with parents and they had come back into care. So the sort of the reentry into care rate in a study with the very, very large sample, many states around the country, you end up with about 25 to 30% of kids who are reunified who come back into foster care over a period of years. And even out of guardianship, that's about 1 in 5 kids. So this is the other kind of aspect of multiple placements that a lot of times you don't really see reflected in studies, and people don't talk about it kind of all that much, is that, it's one thing to count the number of placements that a kid is in within an episode. That is, from the time that a child is placed out of the home until they go into a permanent plan, they're reunified, they're adopted, they go into guardianship. That's one way of counting things. But what about the kids who do go into a permanent plan? And maybe they're in 3 placements the first episode, and then 2 years later, they come back into care, and now they're in another 3 placements. So you have at any one point in time in this state, it's likely that about 1 in 3 kids in the foster care system is in their 2nd, 3rd, or 4th episode. They're not in their 1st episode. In other words, they've already gone into care and they've already had a permanent plan. And now they've gone home, or they've been adopted, or they've gone into guardianship, but now that's failed. They come back into care, and now they go through the whole process again, right? So And again, to say this again, that's not all the kids. Of course, there are kids who come into care who are stabilized in care and who do well in care. We're talking about the ones who don't. So let me say one other thing, couple of other things here about a particular kind of concern around babies. And so I would say that of all the distressing research that I've read in recent years, this is the research that actually bothers me the most, right? So, because of course you have about 1 in 5 kids who are placed in foster care in this state are in the 0 to 1 year old age range. That is, they enter care as infants. And so a lot of those kids stay in care a long time, but they're eventually adopted, right? Well, so it just turns out that a fair percentage of those kids are moved from home to home to home. That is, for nothing that has to do with their behavior at all. That is within the first year of life here. So there had been one of the studies that had made a big impression on me that came out maybe 10, 12 years ago by a group of researchers in the Midwest. They had looked at opiate exposed babies and who were born in a hospital, and they sort of looked at the kids some of those kids end up staying with the moms who were involved using opiates during pregnancy, and there were kids who had gone to relatives, and there were kids who had gone into foster care. And so intuitively, what would you think about the developmental outcomes for those group of kids? That is, developmentally here, kids who stayed in foster care, went into foster care, kids who were placed in kinship homes, kids who were placed with birth mothers. And this, by the way, is a pretty large study. This is a study that several hundred babies in four states, and a very, very careful study. And so what they found was that the kids in foster care developmentally didn't do any better than the kids who were stayed with the birth moms who had the drug alcohol problem. Why didn't they? Because they were being moved a lot. The babies were being moved a lot. The kids who did the best developmentally were the kids who went into the kinship care homes early on in life. Why? Because they were stabilized in care. So general kind of theme here, to, sort of getting kind of this down to the sort of the nitty gritty here in terms of the kids who enter care. Let's just talk about the school age kids here for a second. There's about half of those kids, when they come into care, they have very significant behavior problems. For those kids, and a lot of times, remember, they're coming into care mostly because of abuse, neglect kind of stuff, and combined with drug, alcohol, mental health, all the stuff with which you're familiar, right? So the kids come into care. The ones who have who have pretty serious behavior problems, they are much more difficult, much lower rates of being stabilized in care, much greater risk of being moved around in care. And what the Rubin study found was that for that group of kids, just that group of kids, the ones who came in care with behavior problems, every subsequent move made those behavior problems worse. So I'm going to say that again. Those kids who came into care with a lot of behavior problems, every subsequent move made those behavior problems worse. And so for those kids, after a while, a couple of years in care, you start to ask the question, is foster care doing more harm than good for those kids? Now, that wasn't everyone. Remember, back to this thing. That was about 30% of the kids that they had trouble stabilizing in care. In this 10 to 17-year-old age range, many of those kids who had behavior problems. But fully in this study, about 40% of those kids who came into care with behavior problems actually benefited developmentally from care. So there was a group of kids who did benefit, from foster care. It's just that there were an awful lot of ones who didn't. Now, for the kids who came into care without behavior problems, and particularly in this 6 to 17-year-old age range, those kids, a lot of times, it was much easier to stabilize them in care. It was easier to achieve permanent plans for them in a timely way. those were the kids who benefited from foster care the most. And so in this particular study, they were able to look at the kids, at those kids, just those kids who came into care without behavior problems, and compare the ones who went home pretty early compared to the ones who were who remained in foster care. And they found that the kids who stayed in foster care did the best developmentally. That is, if the kids who entered care who didn't have, so it's sort of like if the kids entered care without a lot of behavior problems, they were stabilized in care pretty early, they got good nurturing, affectionate care, they benefited from foster care. The kids who came into foster care with a lot of behavior problems, difficult to stabilize them, moved all over the place, those are the kids whose developmental problems got worse in care. It seemed like foster care did them more harm than good. Two very distinct populations. So the idea here, of course, is that hopefully we would all want to make foster care a therapeutic kind of experience for kids. And so to do that, we have to take on the challenge of providing a therapeutic kind of care for behaviorally troubled kids. I mean, kids who are behaviorally troubled when they enter the foster care system. Now, there was a third group of kids in that study. It wasn't a super large group, but it wasn't tiny either. And these were kids who entered care without many behavior problems at all. And for whatever reason, they were bounced around in care. They were moved from home to home and home. And their behavior problems began after they entered care, as partially, at least by hypothesis, in response to those moves. That's when foster care does more harm than good. So that's the kind of the situation we're in there, right? So we're dealing with about half the kids in the foster care system who have a heck of a lot of behavior problems, and yet we don't have a whole bunch of caregivers prepared to care for them, or committed to care for them even. Not committed enough to go into training programs, not committed enough to get a certification, and willing to eject them for whatever reason. So has there been a question, has there been any research regarding RGAP? Okay, I'm not sure what RGAP is. Someone's going to have to tell me that, and adoption subsidies and stability and permanent plans. What we know about adoption subsidies is that they really do increase the number of adoptions. We know that. Rates of adoption breakdown have always been lower than rates of breakdown from reunification. We know that. At the same time, as kids get older in adoptive homes, the rate of breakdown tends to go up in kind of a common sensey kind of way. As kids get to be teens, then the rate of breakdown out of adoption, it starts to increase, but it never is as large as the rate of reentry into care from reunification or from guardianship there. So, and again, I'm not sure what the RGAP means exactly, so someone would have to tell me that.
It's basically a subsidy for relatives who get into a Title 13 guardianship with the kid.
Okay, yeah, so the guardianship thing. So yeah, so again, back to this thing, it just as a public, apart from whatever your intuitions are around fairness or rights or whatever thing, about just from a purely economic point of view. Raising the amount of exit, to those kind of permanent plans. And there have been a number of studies that have showed that. Of course, that has become one of the basic kind of social justice issues for lots of advocates in this country who point out that a lot of times adoptive parents are people who have very good incomes, and yet they're getting adoption support payments for kids, right? And you have a lot of kids going back to very low income parents who they're not getting any family support payments at all. And then who would be surprised that there would be a higher rate of reentry into care out of the reunifications than out of the adoptions? Because we're supporting the adoptions in an economic way. We're not supporting the reunifications in an economic way. Which was the study comparing infants who stayed? This is a study, I have, by the way, I think I have this study, but if you want to find it, it's actually available online. The lead author is Bada. B-A-D-A, and there were a number of other authors, but the lead author is Bada. And at the very least, I have the name of this study, the title of it, And I will send this to Ryan, and I have found this study online, so I know that it's there. And I'll send you the title of the study later on today. You know, after this is over, I'll go for a walk or something. But after that, I'll come back and I'll send you the title. And I might even have the study. And if I do, I'll send it to you. And I recommend the study because I think it has a very distressing message. This is not a message that I wanted to hear. And yet it's a very careful study. It's well done. And it has a message here that we ought to be listening to. And the sort of that underlying message to me is that if you want babies to thrive in care, you can't be moving them all over the place for administrative reasons. You cannot be doing that. So that says something about how we ought to be running foster care systems in a way, right? So the sort of the bottom line message for lots of older kids is that moves in and of themselves, it's not moves in and of themselves that are so damaging, it's the ejections. It's the rejection message that goes with the moves that's really doing the harm to the kid. A lot of times planned moves that are done well and in a thoughtful kind of way, those moves go fine. I mean, that's how we're able to move foster kids into adoptive placement, because we do it in a careful, thoughtful, gradual kind of way. It's another thing to eject kids from homes. That's something else just entirely. On the other hand, when it comes to babies, just plain old moving the baby does harm. And so you always have to think about, well, or we're balancing that against a sort of a putative type of a benefit. What's the benefit? So particularly if we're taking care of lots of babies in foster care systems, we want to think about stabilizing those babies as soon as we can. So this is the sort of the rationale in past years for putting pre-adopt, trying to place babies from substance abusing homes with pre-adopt parents right at the time of the first placement. Trying to do whatever we can to reduce the potential for moving the babies around there.
Hey, Dee, are you aware of any good models for transitioning kids from one home to another?
Yes, and the short version is yes. So let me tell you, in past years, this is something that I'm just amazed, because I would say for the first 20, 25 years, for all the bad things, all the deficiencies of foster care systems and so forth, there used to be just a tremendous amount of training about how to do this well. And so this is one of these subjects in child welfare that has been well thought out, well planned. There have been plenty of experiments with it. There have been practice models, all that stuff has happened. So the best kind of guidelines for how to do this well is in this Vera Fahlberg book, A Child's Journey Through Placement. This book came out in 1992. This is still probably the best single book on moving kids from one home to another. In past years, I've done training on this subject for child welfare staff in this state. I've occasionally maybe even done training for CASAs. I even have a PowerPoint on the subject, which I can send you. So yes, they're very, very well-designed ways of moving kids from foster home to foster home, from foster home to adoptive home, from foster home to birth home. There are good and bad ways of doing that. But of course, the general idea there is whenever possible, you want to do something slowly, gradually, in a planned, thoughtful way. Not all at once, not suddenly, not precipitously. And you want to maintain some kind of relationship after with the person from the home where the kid came. I mean, just some of it isn't atomic physics. It's just common humane sense. So yeah, anyway, I recommend the Fahlberg book. I do have the PowerPoint. I will send you the PowerPoint, which you're free to use in any way you want to use that. And the Fahlberg book just is a wonderful, it has so much concrete guidance for caseworkers, for CASAs, for therapists, for everyone who works in the foster care system, because it's a clinically oriented type of book. It's a book based on, it's oriented around practice. And it's been out there for 30 years. And probably there was a time several years ago when I sent out a list of the best 10 books in child welfare, and I think I listed that as the second best book in child welfare that had ever been written from my perspective in that time period. Right. Cherish Kindring also has a transition toolkit available on their website, so that's very valuable information. So let me stop. We got a couple of minutes left. Let me stop and see if there are other kind of comments or questions here.
Dee, that book is so old you can't even get it through Kindle. You got to buy a hard copy version of it. I was just looking it up on Amazon.
I'm curious. What's the price of the hard copy?
They're all around. You can get a paperback too. There's $20 to $30.
There was a time in past years when I was the RA in this state that I caused at the time. I had enough influence in the state where I got every office in the state to buy a copy of that book. So that's one of those things that every office, everyone who works in child welfare should have a copy of that book. Just like everyone who works in foster care should have a copy of the book Nurturing Adoptions by Deborah Gray. Everyone who works in foster care should have that book. Why? Because it tells people how to manage kids who have the meltdowns, the very kind of behaviors that are causing kids to be ejected from homes. The Deborah Gray book has concrete advice and suggestion for foster parents, for adoptive parents, for birth parents, how to deal with those kind of behaviors and problems, that are very specific and concrete by age. And so the Deborah Gray book's she lives in this state. The weird thing was Deborah Gray lives in Bellevue. Vera Fahlberg, at the last part of her life, she lived in the Bellevue area. Most people in this state didn't even know who she was, and they didn't take advantage of her presence here or whatever. But her book is still out there, and it's great. So yeah, and there have always been, by the way, other people in this state who knew an awful lot about this subject. So I just want to speak very highly of Linda Katz, who used to work for Lutheran Social Services. Some of you probably remember her. And she was one of the developers of concurrent planning nationally, but Linda just had wonderful skills and understanding and knowledge. And she is still around. She's still out there. So yeah, there are people around who know how to do this. Yes. And so not just how to move in terms of scheduling and so forth, but the kind of messages, the kind of things, to say to kids. And of course, the other thing that would be very, very helpful in moving kids around is for foster parents to have cooperative, affectionate, at least friendly, cordial relationships with the birth parents, right? That ought to be a public policy goal in the state. That ought to be how we are running the foster care system. We are going to encourage those type of relationships to develop here, not mandate them, not order them to happen, but encourage them to happen, facilitate them happening. So one of the things we know is that when people who are important to kids, when they're on the same wavelength, when they work together, when they have friendly relationships, kids notice that, and it has an effect on their emotional functioning, just as it does in divorce. I mean, if people are going through divorce and they're bad-mouthing one another, what kind of harm are they doing to their kids? I mean, horrible. But the same thing is going on in foster care. As when you have this sort of alienation, this distance, this hostility between these two groups, that's very, very bad for kids.
Are you familiar at all with the Fostering Connections program that is working towards that same sort of goal of creating relationships between foster parents and families sort of early in the case?
Yes, and that is a program that we pioneered when I was in Region 6, regional administrator. Stewart Foundation funded a version of that program in the Vancouver office when I was there. And so that is a wonderful type of a program that we really need to be expanding in this state. And recently, the argument in child welfare has been whether states ought to mandate that kind of practice, which I'm against that. But the idea of funding and expansion of those programs, and we have models. Here's the weird thing. It's the last thing I want to say, and this, maybe today, for just to think it over. Every kind of issue that we've talked about here today, every kind of issue that has to do with how do you stabilize oppositional kids in care? How do you deal with the kids who are susceptible to meltdowns? How do you move kids around in a way that is good for their mental health? How do you support relatives in a way that allows them to keep sibling groups? I mean, every one of those issues, we have successful models in this state and have had them for more than 25 years. That's the really shocking thing here. And yet, as a state system, we're still kind of fumbling around with all of these things where somehow these practices have not been brought to scale in this state, even though they have been there in model form for 25 years. That's the really shocking thing here. So it's not like that we don't know what to do here. We do know what to do. There has to be the political will to do it. And there has to be a bunch of people out there who are able to do it. It's not just a matter of rhetoric. We actually have to have people trained and supported to be able to do this. So she was also King County CASA program manager. That's Linda Katz. I really think the world of Linda. Which was a study, I've already mentioned that one. So, okay. Fostering Connections is there. I have also, by the way, written a sounding board commentary on the Fostering Connections idea that last year. So the last thing, just to renew the promises here, I've told you that I will send you information about the beta study on infants in foster care. I will send you the PowerPoint that I have on moving kids around in care. You can use that however you want to use it. I've given you information about the Vera Fahlberg book, which you ought to be able to find there. And there's information here about the Cherish program, the transition toolkit, which sounds great. And I've mentioned that there are evidence-based programs for dealing with oppositional kids at all ages, from kids who are 2 to 3 years old to 7 to 17. There actually is a knowledge base there. And, you want to know the fundamental idea in all of those programs? There's just one basic fundamental idea. If you want to take a kid who really has a really extremely bad behavior and within a period of a few months, convert them or transform them into a kid who has really pretty good behavior most of the time, you do one main thing. You praise them more than you punish them. That's the evidence-based element fragment that every one of us can learn about how do you influence child behavior over time. If you want to take a badass kid and turn the kid into a good kid, you have to find a way to praise the kid a lot more than you punish them. And so all the programs that are evidence-based, they all use that idea. The question is how to actually do it in the face of some really aggressive, rotten behavior on the part of the kids. That's where the skill in the program, it's not that the idea is different. The idea is exactly the same. It's how to actually do it in the face of all that bad behavior there that the kids are, doing there. So, but the underlying idea is the same. So particularly when you talk about, where we ought to be going with kids who are in this 12 to 17-year-old age range in this country, and not just in child welfare. We need to be using ideas from positive youth development programs. Those programs have been around now for 30 years. Positive youth development programs. So what do we mean? We want to get kids in programs where they will develop pro-social skills. So the only thing that's going to keep a lot of the kids in child welfare who've had these kind of horrible backgrounds that they've had from moving into the delinquency world and ultimately prison and so forth is that we have to help them develop a pro-social skill that will bring them recognition and praise rather than punishment. And it has to be something they can do, a skill. And so that's the underlying kind of idea of all of these programs. And so many examples of how to do that, right? So I think with that, I'll stop. It's 12:07. All of you have got my email address, and then if you have ideas for what you would like me to talk about this coming month, you can either give that to Ryan or you can send it to me directly, and I would be glad to follow up on that if I'm able there. So thank you.